My name is Phil Perazio, and I'm a urologic oncologist, a surgeon. Like many of you, I absolutely love what I do, and I would not choose another profession. But I have struggled with professional identity, practice efficiency, and wellness over the years. Operate with Zen is a podcast designed to explore a mindful approach to surgery and to being a surgeon. By discussing these struggles and mindful solutions, I hope together we can create a community of strong and healthy surgeons. Enjoy. Welcome to this episode of Operate with Zen. Today, I have the great pleasure from being joined across the world, Dr. Jeremy Grummet. Jeremy, introduce yourself to the audience.
Hi, Phil. Thank you so much for having me on your podcast. It's a great thrill for me, and especially in talking about the stuff I hope we'll get into today. So I guess just by way of intro, I'm a practicing academic urologist here in Melbourne. I'm at the Alfred Hospital, which is part of Monash University, which some people may or may not have heard of. I guess like most urologists in Australia, and I'll be interested to know how this compares to you guys, I work part-time in private practice as well. And so what that means is I work in actually 5 different hospitals, which might seem a little bit strange to you guys, but you would typically just work in one, I guess.
Yeah, well, it depends on the system. So, technically at our system in the University of Pennsylvania, when I'm on call, I cover 5 hospitals.
Oh,
but
right.
but my day-to-day is in one hospital. But I do have colleagues who may work at 2 or 3 hospitals along the course of a week.
Yeah. So, there's a bit of fragmentation that you have to manage in daily work life. But I guess on the other hand, I kind of get a window on both systems, public and private. And, sometimes they can inform each other about, things like standards of care and ways of working. So anyway, I guess that's my sort of day to day. I've done and supervised a fair bit of research, which is really focused on prostate cancer diagnostics, especially MRI and transperineal biopsy is probably what I've really mainly published on. And that sort of area of interest led on to creating an online platform, which I've co-founded called MRI Pro. And we made that to design, or we designed it for training up urologists and radiologists into reading prostate MRI accurately. So that's been a real passion project of mine over the last few years now. And otherwise, I guess the main thing I do, and I'm going to spend a fair bit of time on it for the rest of today, is I work as a member on the EAU prostate cancer guidelines panel. I've been on that for the last 5 years or so. And we update those guidelines every year, which is, fairly taxing, I suppose, in one sense, but it's quite fulfilling because I think there's a lot of countries, not just in Europe, that use these guidelines. I know America's obviously got your own set, but in doing that, I'm hoping that it's quite impactful and making quite a difference on, how we practice prostate cancer care, which is not just opinion, but it's really based on hopefully the best and the latest data available. And I guess finally, personally, I'm 50. I've been married for 23 years. I've got 4 daughters, aged between 13 and 21, 2 of them at uni, 2 at school. So as I'm sure you can imagine, home life has been pretty busy, but I absolutely credit my wife for managing the vast majority of that. And again, sort of moving into the more human side. My mum is 89. She went into aged care just a few weeks ago. So it's because her Parkinson's was making her fall a lot. She'd been living at home on her own for a few years since Dad died. So that's been a really big transition for her to manage, but also for the rest of us. I'm one of 4 sons, and we sort of help look after Mum as well. So I guess that's kind of where I'm at today.
Yeah, well, thanks for sharing all of it. And you and I have crossed crossed paths a few times, but it's been really interesting to kind of connect over wellness and mindfulness, which has been kind of a new passion for the both of us. And one of the things I've always kind of respected about your work is contributing to guidelines, writing the guidelines, but also being incredibly passionate and honest about the way you speak about these things. And I've seen some of that come through on the wellness front too. So really looking forward to getting into it today.
Well, thanks, Phil. That's very kind of you. Well, anyway, I'm really prepared to be as honest and open as you like today, because I think it's actually one of the messages I want to get out, I guess, by your awesome podcast today is where, like I said, I'm 50. I guess I'm mid-career. Very similar, perhaps in many ways to where you're at and yours, and you can sort of feel yourself stepping into leadership and a sense of seniority, and you kind of recognize that a lot of the junior guys and junior all our juniors are looking at us as role models. And I mean, we see that obviously in our own kids, in the family, but there's no doubt it's happening in the hospital and at university. So I think there's a better way that we can hopefully conduct ourselves in order to maintain our own well-being.
Yeah. And it's a beautiful segue right into what I was going to ask you is, tell us your wellness journey. We all evolve and our wellness journeys continue to evolve, but kind of bring us through your history of where you started and where you are and what got you so interested in this.
Yep. Very happy to. So actually, maybe before I get into that, I've got to say, I find it hard to land on the right sort of wording in this topic. We talk about wellness and well-being. They're perfectly good terms, and I'm sure you've noticed this, as soon as these things become popular sort of concepts in the psyche, it seems that they get like parodied or hijacked by people with maybe less well-meaning motives, and so I'm just mindful that the more we use that terminology, the more risk we are of sort of being mocked, perhaps. But anyway, I'm interested in this field and talking with you because I'm like you. I'm genuinely curious about it, and I think hopefully I can share some stuff that might be useful. I'll try and use the term well-being because I think it may be slightly less sort of bastardized than the wellness sort of industry that's kind of sprung up, at least in my part of the world. And I guess I'm happy to share, much of my story with the intention of I guess modeling a bit of vulnerability. And I think as surgeons, and probably more so residents and trainees, I think we have a huge fear of showing any vulnerability. And there's really good reasons for that. And yet our vulnerable space, I guess, is really where we all live, whether we're a surgeon or not. Our inner lives are swimming in vulnerability. But I think it's rare that we, let that see the light of day to our outer lives and to other people. So look, I think it's such a shame because, you think about the times when you did let someone else into your vulnerable space, or when you had the privilege of someone else inviting you into theirs. And I remember times like that as moments of really, the deepest connection with other humans, which I reckon when you break it all down, it's what we all really crave. So, I hope maybe we can come back to that later, but I think that this is something anyone in leadership can probably do to help change a less than healthy culture that we may have in surgery into a much healthier one. So I guess I can't really talk about my own journey without giving you some family context, because that's where it all begins. So feel free to cut me off if I go too deep into this. But my, and look, this is the reality. My maternal grandmother, so my mum's mum, she suffered severe depression as an adult woman, and she'd be bedbound for months at a time. So this is when my own mother was growing up in her household, and then, as my mum tells it, at least, she'd appear in the kitchen one day, her mother, and just sort of announce, "Oh, my cloud's lifted," and she'd be kind of back to normal. But this was literally after 2 or 3 months of not being able to get out of bed, right? So that was all happening, once or twice a year when my mum was growing up. So I think, that must have had a pretty indelible sort of impact on my mother's psyche. But to my mum's credit, she's somehow maintained a pretty incredibly positive and sort of stoic outlook on life since then. On my dad's side, his dad also had bouts of depression, although nowhere near as severe, but still, bad enough that he had to go and have stays with cousins in the country for a while to ride it out. Closer to home, I guess, one of my first cousins had schizophrenia and actually very sadly took her own life at 27. That was more than 20 years ago. But again, this is the sort of family context that I've grown up in. And I mentioned before I'm one of four brothers, and one of my own brothers has been plagued by bipolar disorder, and mainly the depressive side of that, really ever since he was 17. So and he's now late middle age. So there's a lot going on there in terms of background, and I'm sure that colours where I come from myself in terms of this whole wellness area. I mean, that is the human side, and I think we're getting much better at talking about this sort of stuff and bringing it out in the open. But certainly in years past, this stuff was never talked about. If people were mentally ill in your family or your friends or whatever, it was all shoved under the carpet and swept under the carpet, I should say. And I think that's a shame, because it prevents us having those, deeper connections where people are vulnerable, like I was saying before.
Yeah. So, and Jeremy, I just want to, take an opportunity to say, first of all, thank you for being so vulnerable with us. And as you said, modeling that behavior. And I think it's just important to note that there is not a person in this world whose family or loved ones is not affected by mental illness.
Right.
And the stigma we have about talking about these things or not talking about these things is something we really need to get over, because this is shared experience. This is vulnerability that sets the stage for where we're going, where you're going with this conversation. Right. So thank you for starting here.
No worries. Yeah, look, I think it's important, and I'm happy to, as I say, I'm happy to share. So that's kind of, I guess. Oh, and I've got, my wife's family side is also had, got a whole lot of similar issues within it, and I won't go in deep onto that side, but you get the picture, and actually it's probably one of the main reasons we met when we were in our 20s, and probably one of the main reasons we actually got together in the first place, because we had this really shared understanding of mental illness in our own families. So that was my sort of background, I guess. Then this is where it starts to really sort of come home. Like, I've always obviously had that background, but then as my brothers and I became adults, our parents obviously got old, they got frail, and we got more involved with caring for one of my brothers, who I said had really quite severe mental illness throughout his adult life. And I think that's a really tricky one when you're the carer of one of your siblings for much of his life, especially when he's older than you. That's kind of a tricky dynamic. It sort of reminds me that when he's well, it's just a sheer joy to just to hang out, because you're just his brother. You're not his carer. So, but the reality is, a lot of the time, then he's not well. You have to switch into that carer role, which I suppose with decades now, you kind of get used to it to an extent. So again, that's sort of how I'm coming at this whole wellness space. Then a few years ago, so I'm like in my 40s, and this is well before COVID hit. So it was, not related to that, because obviously that, we all know extraordinary impact that COVID's had on our not just our physical health, but our mental space. I actually had some pretty stressful stuff going on myself, which really sent me into a spin. So sort of suddenly, for the first time, as being used to that carer role I was talking about for my brother, I actually needed a bit of help myself. And I won't go into all the details by any means, but I think that the sort of stuff that happens somewhere along your life, they're pretty common to experience. Some the slings and arrows that life throws at you. So it wasn't anything really out of the ordinary when I look back at what happened, but it's something I really struggled to manage at the time. So what that translated into was anxiety. So in terms of how I reacted to these situations, I had basically developed some significant anxiety. Now, I'd previously been prone to episodes of feeling a bit flat from time to time, but only for ever a few days. And that's pretty normal part of the human experience, I think. But this is really different. So that was kind of scary in itself. Like I'm in my 40s and I'm thinking, what's this feeling? And I've never felt it before. So and we can go into more detail in terms of what it actually feels like, and I'm sure plenty of people in the audience would be able to relate to anxiety. I mean, it's just so super common, but it was new for me, and I needed to get help myself. It led to insomnia, and just a whole lot of stress. So
Jeremy, I'm curious if you could tell us,
Yeah.
how did it impact you surgically? As a surgeon, in the hospital, out of the hospital, whatever it may have been, what did you notice going on in your surgical existence?
Yeah. So it's a great question, Phil. So I was exhausted. That's what I was noticing. So I was basically running this sort of double track in my mind of doing all the usual problem solving of clinical problems, as we do day to day in the clinics, in the operating theatre. All of that was going on as per usual, but at the same time, I had this whole other set of or stream of thoughts going on about worry and feeling this sort of physical sense of that's what struck me, was this bodily sense of stress / anxiety, which was new. And I'd wake up with it. I'd wake up and suddenly my stomach was in knots, and I'd have a hot sweat, and all this sort of stuff was going on. So it was pretty full on, to the point where, like I said, I really needed help. So I needed to see my family doctor, and actually, for the first time, actually go on medication for anxiety. And again, it's pretty rare that we would talk about this sort of stuff, because I think there's a lot of fear of being thought of as not being as perfect and solid and so on as you should as a surgeon. But when you look at the stats, if you've got we all know how incredibly common things like anxiety and depression are. So and we know how high they are in doctors and particularly in surgeons. So if we go around pretending that no one's actually got it, then none of us are really telling the whole truth. So that's why I think I've got to admit, there's part of me that thinks, I'm not really sure about sharing that sort of information. It's I am feeling vulnerable in that sense, but I think in the grander scheme of things, it's worth mentioning this stuff, because it set me on a path, having had this experience of, okay, I've had this experience. This is a place I do not want to go back to. So he prescribed some medication, which I took. Thankfully, I only needed it for 6 months, and then I came out of it. So this is going back a few years now, and again, that's why probably I feel more comfortable talking about it now. I think if you are still suffering, or you are still in the midst of mental difficulties, then it's really hard to share at that time, because you're perhaps not feeling your best self, your strongest self. There is some comfort, I guess, in saying that, well, I've lived through this and got to the other side, and I'm still carrying on, as a hopefully pretty capable and useful surgeon in the community. So, which is where I'm at now, I think. So,
yeah. And I was just say, Jeremy, I think it's really important to kind of highlight that part of the mood disorder, whether you want to call it that formally or not, is kind of a deranged thinking about reality and not understanding completely where you fit in. And sometimes it takes the perspective of getting out of it to understand where you are. And I think it's really important to highlight. And a lot of the science here comes from the trauma literature. and in people who have experienced, whether it's physical trauma, emotional trauma, whatever it may be, how these things are manifested physically in our bodies, whether it's anxiety, tension, sweats, knots in the belly, whatever it may be, and how a lot of that can be your cues that something is not going on correctly with you, and can be the cue to get help. And I just, in the sense of expressing vulnerability here, I was a resident and was really struggling in residency, had some pretty significant stuff in my family going on, and ended up going through a divorce. And 6 months of SSRIs made a huge difference in my life and helped me get things back on track. And big benefit. And getting sleep, getting help, reaching out was one of the greatest things I ever did. And I encourage people that this is shared human experience. We all experience trauma. We all experience, I loved how you call it slings and arrows, and we end up in spins. And when you're in that spin, recognizing the things that are going on, to recognize, first of all, I'm in a spin, and then trying to seek the ways out of it. Right.
Well, I mean, I've got to thank you for going there as well, Phil, because it's not easy necessarily, I think, in our culture to just talk about this stuff. So, I think it's incredibly important that we do sort of fess up to reality, and not keep trying to hide this stuff. So thanks for mentioning that as well. And I guess what you're alluding to as well, like, it was such a circuit breaker. Like, I was pulling out all the, the cognitive sort of therapy on myself and trying to read the right books. It just didn't allow my body to snap out of its pattern that it had gone into. And again, that's what was so weird, was that, like I'd said before, as a younger guy, you'd have a few days where you're a bit flat and whatever, but it was all very mental, I thought, whereas this new experience was so physical. And actually, it reminds me, of that book, which I have to admit I haven't read, but I've certainly heard about. But I love the title, "The Body Keeps the Score." I don't know if you've read that one.
Incredible book.
Right. So I think that's very much what you're alluding to there, in terms of, traumatic experiences and stuff. And obviously there's a huge variation in trauma that we may experience in life, but how you respond to that or react, depending on what your skill levels are in that sense, is super important. I think that's where there's a huge amount that we can help each other with and help our colleagues with, because I don't think it's anywhere near part of our sort of core curriculum that we come through with. And yet, I mean, life as a human is tricky enough, but then throw in on top of the fact that you're a surgeon and you've got a stressful operating situation, but you've also often dealing with, patients every day with life-threatening illnesses. And we just suck it up. We take it on board. It's like, yeah, that's what surgery is. We do it every day. And that's truth in that. But then have a look at the stats. Look, like I read on David Keynes's website, his well-prepped app, and he talks about 46% of doctors have burnout. Now, half of us have burnout. That is insane when you think about it. I mean, that is not okay. There's a whole bunch of individual doctors who have got to, step up and learn a few things. Of course, there's stuff that we need to talk about there, but it also, I think, when you've got that sort of proportion, tells us there is an endemic systematic problem within medicine or surgery or the smaller bubble of urology, that you and I can hopefully help with, where we need to address, okay, why is this? We need to go back to the origin of how we got here. So,
yeah, Jeremy, once again, you bring up some great points, and burnout is another one of those terms that has gotten thrown around and occasionally has a bad connotation. I think, honestly, because of the way a lot of our administration, not to put this necessarily on people, has kind of viewed it as kind of this thing that needs to be addressed, instead of the people and the systems that need to be addressed. But it is, and you called it the spins before, or burnout. I mean, we're talking about the same thing here. And I think the other thing that's really important to highlight is you talked about, and listen, as surgeons, we take care of people all of the time.
Right.
And I don't know about your practice, but in my practice, a fair amount, specifically with testicular cancer patients, I have mental health conversations all the time, right?
Right.
More testicular cancer survivors will die of depression, anxiety, suicide than will die of testicular cancer. That's just the nature of the disease. And so if we don't have that conversation, we're doing them a disservice. Yet how many of us are afraid to have that conversation amongst ourselves or to each other? And
Mhm.
it's a really important thing to highlight.
Yeah, and so that's probably I've talked about vulnerability, making ourselves vulnerable to an extent, and you got to do that in a safe space as well. Like you don't want to be cavalier about it, um, but that's one thing. But the other thing I think is just creating, starting the conversation, and I think that's exactly what you're doing. All credit to you with this podcast. You're a surgeon, but you're happy to go there. You're talking about philosophy and psychology and well-being, and we need to explore these spaces, not just, and I think this is the kicker, and this might just be the hook that gets surgeons into thinking about this more, is not just for our own well-being, but this makes us care for our patients better. So, no matter how masochistic or maybe unself-caring we're prepared to be for the sake of our patients, it's totally false economy. Doesn't make sense. Patients get the best care by surgeons who take care of themselves. So if you want to be truly professional, and that's another sort of tag, we all want to be professional. That's sort of I guess the milieu that we've grown up in. In the current era, it's not enough just to know what tests to order, when to operate, or more importantly, when not to operate. You've got to know how to take care of your own well-being in order to provide your patients, I reckon, with the best possible care. Or you'll end up another statistic. In fact, even if you do all the right things, for your well-being, you can still end up a statistic because you're a human being. So it's definitely part of the message I'd love to get across.
Yeah, I'm going to say it again here, and I'm sure I'm going to say it again when we summarize, but patients get the best care from surgeons who take care of themselves. And I think that's an incredibly important message. So take us through it. Now that you've started, you've come through your personal struggles and issues. And if you want to if you want to finish more of that story, please do. But tell us how you think about helping, colleagues and trainees and the people underneath us. How do we do this now?
Yeah, so maybe I'll try and answer that in two parts. I guess just to finish off I said that it sort of sent me down a new path. I mean, I've always had an interest in philosophy and psychology, but I've never done any formal educational training in those areas. But because I'd had this lived experience, oh, hang on, this is, life is suddenly not going as well as I'm used to. It really sent me down that path much more deeply, so that when I wasn't working as a surgeon, my off time and after hours and whatever, I was just devouring books and podcasts and so forth in all this stuff. So that's sort of, I guess, just snowballed into what I want to do now, which I'll come to in a minute. But I did want to just maybe highlight a couple of things that I found really helpful at that time, and this might be useful for the audience as well. Is one of the resources I started with, and I think I just stumbled on it really, was the School of Life stuff. I think you and I might have mentioned this in previous conversations, but Alain de Botton, who's a British philosopher, has created what's called the School of Life, and there is an enormous amount of extremely useful content on their site that you can sign up to, and it's in little bite-sized pieces. So it's not like you have to open some tome of philosophy to get the nuggets. He writes in these beautiful these little sort of vignettes about all sorts of different specific aspects of how to live, and all the different stuff that all the challenges that we come up against, and how we might cope with them. So that was, I just plowed my way through that, and part of it is using all. It admittedly focuses probably much more so on Western philosophy than Eastern, but found it hugely helpful. And then the other thing that really helped was Sam Harris's Waking Up app, which I'm sure many of the listeners would have heard of and maybe are using out there. I found that really interesting. That's really a meditation app. And at that time, a few years ago, I think in my mind, I didn't really know what meditation was. I'd never done it before. I guess had this connotation of what maybe we might say here in Australia as being a little bit wanky. I don't know if that resonates in the US. But I couldn't have been more wrong, obviously. But that's just what I thought. But what I found with that is that it gives me an entirely new way of approaching my thoughts and emotions, which is super helpful. There's heaps of apps out there that people can look at. And this particular one sort of appealed to me because it's kind of pitched at an intellectual level, and I think as maybe as doctors and surgeons, that is quite attractive. So it really appealed to my intellectual curiosity about stuff like what is consciousness, what is the self, and things like that. And you can go as deep or as shallow as you want into those things. But for me, I found that really appealing because that was all part of. It wasn't just here's 10 minutes of doing meditation, but here's what it's all based on. Here's the background. Here's the context, the history of why we're doing this. And I found that really useful. So anyway, that was, I guess, the pathway I went down. And so I thought, well, if I'm feeling this, and if I've, had these experiences, and I've been, I'm a mid-career surgeon, there's no way I'm alone here, right? There's going to be so many of my colleagues and also juniors who are going to be experiencing similar things. There was a point where, I was struggling. I didn't have the tools and the skills that, in retrospect, would have been probably extremely helpful to frame what I was experiencing in a much more useful way. So I thought, well, there's scope here. Scope here to use my lived experience to hopefully help other people. So one of the things I'm doing, Phil, is I guess starting to try and do this help. I guess first of all, doing this podcast with you is hopefully going to help get the message out there, but perhaps more close to home. In November this year, I'm running a session. So every year, all the urology trainees in Australia and New Zealand get together for what they call Trainee Week. There's about 80 odd trainees from across the two countries get together for the whole week, and we as consultants are invited in to speak and discuss, all the usual issues, prostate cancer, stones, blah blah. And so I got invited to come and speak. The hospital that I work at is kind of renowned for its trauma care. So we're like a tertiary trauma center, so we see a lot of kidney and bladder trauma. But when I was asked, I thought, well, yeah, I'm very happy to speak to the trainees, but is it okay if I choose the topic? And it's a little bit different to what you've asked me to do. And so I said, can I run a session called The Surgeon as Human? And to the organizers' credit, they said, yep, that sounds awesome. Let's do it. So we haven't done it yet, so I've got to be careful about cranking it up too much, because it'll be really interesting to see how we go. But I've got 3 cracking speakers in for the session. So I've got 2 organizational psychologists. Jackie Knight is one of them. Another one is Sharee Johnson, and she's actually written a brilliant book that anyone in the audience can obviously get their hands on. It's called The Thriving Doctor, which I would strongly recommend. So she's fascinating, Sharee. She's been a psychologist for many years, but she's really homed in on working with doctors. So that's really her whole practice. She's both a psychologist and a coach for doctors in Australia, and presumably she can, with Zoom and so forth, she can do it with anyone in the world. But she's fabulous. So she's going to come and speak. And we have a mindfulness meditation expert, Professor Craig Hassad. So he's been in this space for years. He's been an absolute front runner in mindfulness meditation, but he's coming at it from the evidence-based scientific perspective. He wrote a terrific book, and again, this is like 20 years old now, called Know Thyself. It's not specifically directed towards doctors, but it's all about mindfulness meditation. So I'm thrilled that these people are going to have access to all of our local trainees, and I'll be really interested to see what their response is, and I'm hoping that it'll be a really useful session. So we just got 2 hours to bring it all together, and we'll see what happens.
That's pretty incredible. I wish you the best of luck in that, and look forward to seeing some excellent results, and hopefully maybe even tuning in from afar if it's allowed. But I just want to say, I think you and I think very similarly on this. I think if you think of the progression on how we get better, I mean, if you want to think about tangible steps, if somebody out there is thinking on how do I make my local community better? How do I make the hospital better? How do I make my specialty better? How do I make surgeons better? Start with the message and just having conversations.
Yeah.
Model the behavior, and then start, as you kind of get experience talking to people, start planning out the formal work, and it kind of will progress naturally, and you'll learn kind of what the audience needs, what you need, and how to, getting back to where you started, how to be vulnerable with them and express these important aspects of our life. And I think to that point, and also with the title of your session there, the unofficial theme for this season on the podcast has become, I'm a physician and a human, or I'm a surgeon and a human, and that we have these dichotomies. And in a very Buddhist sense, we are not one and we are not both. We're all the same, right? We are surgeons, right. We are humans. We exist in both of these spaces, and they are incredibly reliant on each other to be successful in those spaces.
Yeah, absolutely. Yeah. And I think, we can, it's a bit like what you were alluding to before about it, hospital administration, how they deal with burnout. You can have a kind of a knee-jerk response where you sort of go straight into problem solving mode, and you think, okay, there's a problem here. I'm exhausted, I'm burnt out, or whatever. Let's do yoga, let's do more running. Now, I'm not dissing those things. They're super important and really useful. But I think it's probably, to be even more holistic, go back to the start, open up the conversation, and recognize that the problems we're experiencing are much broader than that. They are human issues, and they're exacerbated probably by our surgical culture. And that's that's the starting point, I think, of how we try and correct the issues that are occurring. I mean, we've talked a little bit about burnout, we've talked about anxiety, depression, but then you've got substance abuse, you've got bullying and harassment. I'm not sure in the States is an issue. It's been a huge issue in the media, right, in here in Australia as well. Something that we're all trying to work on, and then even to the worst extent, suicide. And as I said before, all of these issues indicate terrible suffering for the doctor or surgeon themselves, but they also are going to have a negative impact on patient care. So I wonder, Phil, if you're happy to, because one of the things I did want to sort of discuss with you and get your thoughts on this actually is how did we get here? And because maybe just while you're thinking about that, because I've got a bit of a theory that I'd like to sort of put out there. And I think one of the things might be, I'm really sort of focusing on surgery now, is, where did this culture come from? Why, for example, are our workdays punishingly long and just an expected norm? Why do some of us do such early morning ward rounds that often actually wake patients from what should be restorative, recuperating sleep? Why the strictly vertical hierarchical sort of department structures, etc.? Now, as I say, I'd love to hear some of your thoughts, but I reckon possibly a lot of that sort of stuff, and I've only picked out a few sort of little examples, I guess, maybe it derives from military history and surgery in wartime, which is obviously mostly trauma. So that's where a lot of our advances in medicine and surgery have come from. if you're trying to mend the wounded out in the field, there's not a whole lot of time for niceties, and there is a real imperative for orders to be obeyed, for protocols to follow. It's what you've got to do that, and there's no arguments, no questioning, or the soldier in front of you might bleed to death. So I just wonder whether this template for sort of expected behavior and culture might have been laid down, over the decades since the, World Wars I and II. And, if that's the case, how useful is that in present day, mostly peacetime elective surgery that we conduct on a day-to-day sort of basis? I just wonder if it's a bit analogous to, you've got your chronic versus acute stress response. And, if you're constantly working to the bone under a whole lot of stress without any balance in your life because, you're doing it all for the patients, well, we know that's just not sustainable, right? And that chronic stress response, your mind and your body are experiencing are going to almost certainly end up in causing some sort of illness at some stage. On the other hand, you've got, the acute stress from time to time. Well, that's a natural part of surgery and life. And there's no getting around that. But that's okay because you need to experience that stress. Let's say you've got a sudden bleeder from some unexpected anatomy. You need an appropriate stress response in order to handle that rapidly and appropriately. And that sort of acute stress, to my knowledge, that doesn't affect your long-term health. It's that chronic stress response. So I wonder, I'd be keen to hear your thoughts, but I just reckon we probably need to transform our surgical culture into one that's a bit more like that acute response from time to time, but most of the time we're running perhaps a little bit more on our parasympathetics rather than our sympathetic system. And that we recognize that we're humans before we're surgeons, and all that goes with that, because there's a lot, and that's where the conversations are, where perhaps we value balance before overwork, because we know it's better for us, but also for our patients, where maybe we stop, praying to the gods of productivity, and although don't get me wrong, productivity is really important, but maybe just put it back in its place below the rung on the ladder where well-being sits. So, we can still prepare our surgeons for all the hardships that will simply happen in a surgical career. But I think we can potentially do things differently. I've rambled on way too long.
No, there's some beautiful thoughts there, and I'll try and tackle each one. You kind of asked, how did we get here? How did we arrive here? And I'm not sure we've arrived here. I think we've kind of always been here. We're just finally starting to get to the point of self-awareness. And I think the history goes back even further. I mean, if you look at the history of surgery, or even of medicine, I mean, the earliest physicians were kind of in the priest classes, right, where there was an association with divinity, and I'm talking kind of not prehistoric, but BCE here at least.
Wow.
And then it evolves, as you said, kind of into wartime surgeons, particularly in the Hellenistic era. That's where a lot of our anatomy and understanding comes from. And then literally, throughout the Enlightenment and before kind of what you call modern surgery and before anesthesia, the best surgeons were the fastest surgeons, right? That was the whole, right? We couldn't put people to sleep. So you weren't judged by how well you did an operation, but by how fast, because you inflicted less harm to your patients if you could operate quickly.
Yes.
And and I think the hierarchy was built into that, right? You really had to follow the person who was leading the room. And I say this all of the time now when I talk to trainees, and I start and I lecture now on kind of how we fit in and how we change surgical culture, is there needs to be some level of hierarchy for safety, right? We need to be able to follow orders and report up. But that level of hierarchy does not say that one person is better than the other person in the room. And I think that's where surgeons and surgery has gone wrong, is the God complex, the ego complex, that I'm the most important person in the room. False, flat out false. The patient's the most important person in the room. And everybody in that area or involved in their care is vital to their care. Nurses, techs, the people who clean the rooms, anesthesiologists, surgeons, all have different skill sets, all absolutely essential to quality care. And I think it's removing that ego is part of the process of improving our culture. So I hope that was some answer to kind of the,
Absolutely.
that where that comes
I
from.
love that. Yeah, I love it. No, totally agree with that, Phil. Yep.
Yeah. And I think, I think some of it is honestly just human nature. You talk about the early AM rounds, waking people up. You're right. That makes absolutely no sense. The other one that makes no sense to me still, and I think the residents are starting to get better at this, is rounds. Why do we go around to every single room and write notes in 2022 when we're recording this podcast? I mean, listen, I trained at Johns Hopkins where the term came from because there was a rotunda that you literally walked around in to see the patients.
Interesting.
And even when I was a brand new resident, you had to go to each patient's room to get their vital signs. So there was a sense of rounding. Now everything's electronic medical record. You could sit in a conference room, efficiently go over each patient, develop a preliminary plan, and then, as you said, at a much better time when the patient's already awake,
Right.
go validate your physical exam, verify your plans, go over it with the patient in a much more kind and thoughtful process. But we're creatures of habit, right? And it's hard to change those habits. It's hard to change culture. So maybe over time we work on those things.
Yeah. Yeah. No, I think that's great examples. But this is where I think people of our sort of vintage, it's time for us to step up and just even have the headspace to have those ideas, because that's the thing. You get so busy that you don't even get it. Your brain doesn't get a chance to think outside that habit space that you've been doing on every day for the last 20 plus years. So for us to actually make thinking time part of our schedule, actually, why do we do it? Stuff like this. Is it beneficial for our patients? Is it conducive to our own well-being? And if it's not, rethink.
Yeah. 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 And there's a classic quote, and I can't remember the attribution right now, but if you're too busy to think, you're too busy.
Yeah, absolutely. I love it.
Right.
Yeah, totally. Maybe there's one. I mean, I know we're coming to an end of the time, Phil, but there's probably one other thing that I think is super important that often gets overlooked, and that's just humor. It's so important that we don't lose that, I reckon, because again, going back to what we were talking about before, we've got a serious job. We're cutting people's bodies and hopefully mending them and curing them and helping them, but we can't screw it up, right? It's pretty important stuff. And so when you do that day in, day out, when you then have those consultations with patients who have had a complication or whose cancer you can't cure, etc., that can, I think, you can potentially become a little bit calcified into a kind of a serious or solemn mindset. And that's entirely appropriate to a point. But if it overtakes your whole mindset, then I think you've got a problem. So I just wanted to put in a plug for trying to remember to keep things a bit light. And whenever you can crack a joke, take the piss out of someone in the nicest possible way, because that tells them that you love them, basically. When you can take the mickey out of someone, that you've got a strong bond, I reckon, and vice versa. So that's the sort of stuff I think we should really try and remember to incorporate day to day in our lives, because I think there's a bit of a tidal pull away from that into the land of seriousness, and seriousness can also breed that self-importance as well, which is a real danger. So yeah, I just wanted to throw that idea in as well.
I think it's beautiful, and it gets to the point of being human again, is expressing humor and connecting people, and humor is often vulnerability as well too. And it is expressing kind of the light side of some very serious matters sometimes, and it's an important way to connect with people, just like it is to talk about the seriousness of their disease or the seriousness of the treatment you're recommending or whatever it may be.
Yeah. And sometimes it has to be dark, because dark humor, because that's the nature of what we do. But that's okay. I think dark humor is useful, and we should embrace it.
Yeah. Especially listen, grave situations.
Mm,
And sometimes it's just that's the natural progression, right? It would be pretty inappropriate to try and fit something, rainbows and unicorns
correct.
into that. Yeah.
Exactly.
And I
Exactly.
think it's important to touch on the topic you brought up too about kind of the acute and chronic stress response.
Right.
And you're right. I mean, to be honest with you, part of the reason surgery can be so much fun for some people is that acute kind of
Yeah.
adrenaline rush, right? It really can induce, and instead of calling it kind of an adrenaline rush or kind of giving that connotation, but really a flow state, right?
Yeah.
Where we have heightened catecholamines, we're in the zone, we're taking care of a patient and a very acute issue. That is an incredibly seductive time for surgeons, and it really does get to the core of why we enjoy what we do. We're not only are we having an incredible experience, but we're doing it while we're caring for someone. That's
Yeah. It's
that's an incredibly powerful moment for us. But you're right, that gets lost, and you lose that value when your mind is spinning and you're out of control. And to get back to kind of the burnout or even the term used before, the spins, when things are out of control, not only can you not experience that, but it puts you and that patient in an potentially unsafe circumstance. And
right.
we've all operated in stressful situations. We've all operated with stressful things going on in our lives. And very few patients have gotten harmed,
Yep.
but there is always the opportunity that they can. And if we
Yep.
have the ability to address those things beforehand and create foundational, once again, to use the term wellness, but foundational
Yeah.
wellness,
Mm.
I think it's incredibly valuable to who we are. And it's a great point to bring up.
Yeah. No, I agree with that, Phil. And I'm glad you brought up that flow state as well, because I've probably been a bit of a down. I've been talking about negative stuff a fair bit, but you're right. How fun is it to do, a complex operation well? And like you said, or you can be confident that the patient's going to have a really good outcome. I should take that back. You should never know. You can't even high five anyone even when they head out the door, because you never know what's going to happen. But you can be confident because you have put all that effort and the years of training into learning those skills and knowing how to do it. And when you do it, you get into that flow state. It is pretty cool, right? It is a great feel, and it's a real privilege that we get as surgeons to be able to do that, I reckon. And that's the sort of stuff we want to also instill in our trainees as they're coming through. But in order to be in that flow state, yeah, you need to have your head right.
Yeah.
And that's what I think we can all work towards.
Yeah. It's incredible. Jeremy, I want to keep running with this if you're okay. I mean, I'm having a
Sure.
great time,
Yeah.
and I think there's some
Okay. Yeah.
really,
Cool.
really important things here. One of the things you brought up, and I would like to get into in a few minutes, is kind of meditation and formal mindfulness.
Mm,
And the first thing I want to brought up is you said you got into it by looking at the background and kind of the history of meditation, and that made sense to you. I have a daily meditation or mindfulness practice. I got into it reading into the science of it and how the
right.
science works. And I
Mm,
think there are ways that people can get into this, and it's incredibly fascinating subject
mm,
area.
mm.
But I'd just like to ask you, kind of, what's your mindfulness practice at the moment? What are you doing? What's your practice, and how have you found it to affect you?
Yeah, yeah. So it's nothing fancy. I literally just and it's not even every day. I don't. There are pros and cons for being too regimented. I think I don't want to sort of straitjacket myself into I must do this every day sort of type thinking. So I do it, I guess, when I do it, and it's probably a few times a week, but it's literally only 10 minutes at a time. And I, like I said, I do use the Waking Up app that Sam Harris has put out. What I like actually about his app is that it's not necessarily just the one person guiding the meditation. He's got a whole lot of other real meditation experts from across the world who can give these guided meditations. I struggle. I have to admit, I struggle with just self-guided meditation. I do like a little bit of direction, and I'll typically do it at the very beginning of the day. So just to, you compare it to waking up and checking your Twitter feed as the first thing you do. You couldn't be, more poles apart than getting your head in a centered, balanced, peaceful state than starting with a few minutes of meditation. So that's what I do. And I'll go into, if it's warm outside, I'll go and sit out in the backyard, which is really nice. If it's cool, I'll go into my study and sort of seal myself off for about 10 minutes before I enter the day. How about you? What's your practice?
Yeah, it's like everything, it's always an evolution. Currently, my practice is I wake up in the morning and I do yoga, and usually 10 minutes of mindfulness directly after that. Mm-hmm. And for a long time in the morning, I needed a guided kind of meditation. I was just kind of too all over the place, but I'll tell you, currently, as of the last probably month or so, I now just kind of have a timer, and I've embraced 10 minutes of silence, and I'm doing it myself. Nice. And usually the first few minutes, my mind is all over the place, but I've embraced that. I've embraced kind of the default mode network of our brain, where it's connecting all of the thoughts that were going on overnight or what's happening for the day. And I found by just letting that happen for 2 or 3 minutes, I then get 7 minutes of kind of quiet. And beautiful. Instead of trying to fight that, and that's where I am right now. And listen, I'll be somewhere else in 2 or 3 months, and I'll be somewhere else a year from now, but that's kind of my meditation practice now. And I found tremendous benefit. The analogy I like to give is yoga, for instance, giving me tremendous benefit in physical self-awareness, understanding what parts of my body I'm using. And meditation has given me tremendous benefits in self-awareness of my mind, where I am emotionally, physically, when I'm feeling taxed, when I'm feeling stressed, helping me understand what's going on with my mental state. And I think that's been a huge benefit. And listen, 10 minutes a day is really, if you think about Netflix or movies and Twitter and all of the other things we spend time on, 10 minutes a day for mindfulness that makes you better throughout the day is a minor investment.
Totally. It's, exactly right. 10 minutes is nothing, right? And it's, given all of the distractions that we will get sucked into for well over 10 minutes, probably, it is way more valuable. And I totally agree with that. And I love what you said about evolution, because that's the other thing I think, again, sort of talking to perhaps to our juniors, is no one's got it sorted. No one's got it all figured out. We're all works in progress. And I think to say that we're evolving, whether it's in meditation practice or just even as people, is super important. I think that's something that, when you're a kid, you look up to adults and you imagine that they know stuff, and they've got it all worked out, and this is how the world works, and so on. And it's a myth. They know more than you do, but they're, if they're particularly if they're looking for a bit of self-exploration and an examined life, then they'll be on a journey, which doesn't finish until you drop off the twig.
Yeah, absolutely. And then you're somebody else's work in progress at that point, as they're trying to figure you out. But I see that right now. And you talked in the beginning, just to kind of bring this full circle, about your family and your mother and kind of transitions and struggles there. And I see this with my grandmother, who was incredible inspiration for our whole family. She's now 102 years old.
Wow.
And honestly, up until the last few months, was the sharpest elderly woman you've ever met, an incredible rock and backbone for our family. You'd go to her for advice, anything, she'd seen it all and she'd done it all, and her stories were incredible. And now to see her starting to struggle with mental deterioration, to be honest with you, and some days recognizing how good she is, and other days recognizing that she's slipping. We're all in evolution, and we're all challenged. That's the human experience, and thank you for bringing that part of this up too. Well,
that's a very Buddhist sort of aspect as well, isn't it? Is that you shouldn't be expecting anything to be constant. That is life. It is just constant change, actually. So hence the evolution. Yeah.
All right. So we've been talking about some amazing things for a while. Last words, Jeremy, anything else you want to kind of talk about?
Um, I think like you said, I think we've covered so much, Phil. It's been awesome. Um, like I said, I guess just sort of rounding it back is having these conversations. They're not easy for surgeons, I think, to have. Our training and our environment and our culture is such that it's not necessarily been conducive, and I think there's so much unwellness around that, which is it's basically endemic. It's not just sporadic. It's all around us. That it's really important that we at least open up the conversation, and hopefully we've gone some way to achieving that today. So I'm really appreciative of you inviting me on the podcast. It's been awesome.
Yeah, and I'm really appreciative of you having the time and us be able to connect from around the world. Technology is amazing, isn't it? Sometimes makes you really grateful for some of the things we're able to do.
Yeah.
So just to kind of summarize some of the really amazing things that you've said today and that we've gone over. We started with modeling vulnerability, and we talked about how important it was for vulnerability, not only in kind of our personal relationships, but in patient care, in leadership roles, in bringing up the next generation, and really expressing that vulnerability through a variety of means. But that's a great way to connect with people and expressing our fear rather than kind of hiding it in that stoic surgical sense. We spent a fair amount of time on mental illness and how it affects all of us, how it affects our families, how it affects our loved ones, and whether we're diagnosed or not, how the human experience has, mental challenges and emotional challenges to it. And part of that, one of the great contextual things you brought up was kind of the role we are constantly going through between being a carer or a caregiver and being the recipient of care. And as surgeons, we are not very good at being the recipients or seeking that care. And it's okay to let others care for us, and it's okay to seek that care. We spent a fair amount of time talking about burnout, and I really like your term spin, because anybody who's experienced that, spin is a great way of putting it. It absolutely feels like you are in a cyclone and things around you are just going a million miles an hour, and you don't know whether you're going left, right, up, or down, but you're just trying to put one foot in front of the others. And that story was incredible, and how you came out of it, seeking out help, being okay with medications, whether it's short-term or long-term, whatever you need, but also recognizing that exhaustion is part of this. And when you're not feeling like yourself, it may be time to kind of sit there and try and be insightful and thinking about who you are. And the punchline of that whole story was patients get the best care by surgeons who care for themselves. And I think that really was kind of the theme for the day. And so I'm going to say, I wish you the best of luck in your Surgeon as Human course with the trainees, and really look forward to hearing how that goes. Really look forward to connecting on some of the books that you mentioned and some of the people you mentioned kind of throughout our conversation, and really look forward as we finish to discussing evolution, how we evolve as surgeons to be better, kinder, to care for each other, and ultimately to deliver the best care for each other and for our patients. So,
yeah, no, I think you've summed that up beautifully, Phil. And I suppose if I can just maybe say one more thing, it's a first step, I think, for any surgeons out there who want to sort of go down this path is to start by exploring who you are yourself. That's the starting point, I think, and then everything can flow from there. But that first step can be, you have to be intentional about it and really decide, if I want to be the best surgeon possible, let alone human, then from a professional point of view, I actually need to do a bit of work on figuring out who I am.
Couldn't agree with you more. Jeremy, thank you so much for your time. Enjoy your day, and I look forward to seeing you in person some point in the future.
Yeah, me too, Phil. Thank you so much. It's been fantastic. Cheers.
Thanks. I know a lot of people are going to benefit from the conversation, so thank you.
Pleasure.